Hey, Dr. Lindsey here. This is a 13-month follow-up on a younger patient who has a video that we did around 6 months. I will make an attempt, I'm not real good with computer stuff, to put that video in my description because it has an interview and I think his mother chimes in the interview as well. We were really busy the day he came for his 13-month video and he had to get back to school, and I think the roads were bad. We had 6 or 8 inches of snow here. And so this 22-year-old came in looking like this, and we did 2,600 grafts on him by strip technique a year ago, 13 months ago, over Christmas break. And then at 6 months, he looked fantastic. And now it's been 13 months, and he looks completely unremarkable. And here's a close-up of his scar. Very difficult to find. I do worry more about scars in young people, people darker than me, and people that are active, because a lot of people his age and my kid's age, you're moving your head all around, and that can, all the time, and that can stretch your scar a little bit. Older guys typically aren't quite as active, but he did great, and his mother's in the healthcare industry, and she did a great job making sure he put vitamin E on his scar. And so I've got lots of younger patient videos, and if you're a younger patient, show this to your parents. If you can find his interview at 6 months, show that to them too, and certainly show 1 or 2 of my other young guy patient videos to your parents and ask them to come in with you, because when we do younger patients, you have to keep a couple things in mind. One is you're probably going to need another one of these, maybe 2 or 3 more of these if you start down this road. 2, there are things that we would describe as miracles, cloning, gene therapy, all that kind of stuff coming, but not until, my guess is 15 to 18 years from now, and this is 2026. And you need to have a hairline that will look okay when you get old. A lot of younger people want a hairline down here because that's where all their buddies have hairlines, but if they were 45 or 50 and had that hairline, that is an irreparable problem that will call attention to a bad hair transplant. We definitely work on young guys, I won't say all the time, every month, every 3 weeks, and we're happy to do it. I'd like you to come with your parents if at all possible. Thank you.